Dear viewers, welcome back to the studio. So winter or seasonal diseases occur mainly during winter from October to March. So now is the perfect time to understand how winter vaccines work. We have been joined by the resident in Kuwaiti Board of Family Medicine, Dr. Ahmed Al-Bsiri, who will be giving us more information about this topic. Good evening, Dr. Ahmed.
Hi, good evening. Thank you so much for having me.
It's our pleasure. So we're going to be talking about a very important topic today. How are you doing to start out with?
I am doing very well. How are you?
Great, thank you. So let's start. Talk to us about the seasonal diseases that we might catch these days. There's so many. Everyone is scared, especially with COVID being around.
Exactly. I think we are in a very difficult time, especially with the with the COVID, the pandemic itself. So the seasonal diseases, as we get into the winter months, they are the common things that we've seen before. So the common cold, which is more present maybe like in young children, but also the average adult might get 2 to 3 times in like 1 year.
Right.
We also have the flu or the influenza itself, and this is caused by 3 different influenza viruses. So each year, these viruses might change its structure. So we need to get annual vaccinations for these viruses.
Yes.
And also, as the country is also experiencing some bouts of rain, some people might have some asthma exacerbations. So I think it's very important to talk about that as well.
Yes, so of course, how about we talk a bit about that? What should these patients be doing when it rains? Is it better if they don't leave their house? What kind of procedure should they take?
Yeah, so when it comes to the asthma exacerbation, first of all, I think it's very important to make sure that these patients they are taking their medications regularly, that they keep their inhalers and ventilators in hand, just in case they need them. When it comes to rain, it's very important to stay at home and limit the activity outside of the house, and definitely keep using their medications and inhalers. And whenever they are experiencing shortness of breath or that they cannot breathe, even though they're using their medications, they should definitely seek medical help through the nearest medical center or even the hospital.
Yes, of course. So it was surprising that early on this winter we did experience rain. So thank you for this information. I think it's really helpful since it might be a very rainy season this year. So what are the vaccinations that we can get to avoid these seasonal flus? Are there different ones for different flus, or is it just a normal vaccination?
Yeah, so when it comes to the winter vaccinations, we started back in October with 2 main vaccinations. One of them is the flu vaccine, and the other one is for the pneumococcal vaccination. So I'll be mainly talking about the flu vaccination, which is the vaccine that we should take annually.
Yes.
Rather for the pneumococcal, where there are certain conditions as to who to take it. So when it comes to the flu vaccine, as I said earlier, these viruses, they tend to change their structures each year. So we start to notice what are the strains of the viruses that they are circulating this year, and based on that, we produce these vaccines and give them to the public. So the flu vaccine definitely helps protecting yourself from getting the flu.
Yes.
It also protects from getting complications because of the flu. So the flu itself might lead to for example, pneumonia or acute bronchitis.
Right.
So these things might actually get you to the hospital, and sometimes lead to serious complications, even death at times. So it is very, very important that we take these flu vaccination each year.
So you just mentioned how important it is, but a lot of people do not take the chance and actually go to get the vaccination. Although here in Kuwait, we're lucky to be able to have it, and it's available to really everyone.
Exactly.
So how important is it? Why do you think some people like shy away from taking the vaccination or just don't make the effort?
Yeah, I think in previous years there wasn't like much care, I guess, for taking the flu vaccine. But I think the Ministry of Health and doctors in general have been like very active in social media to get people to get vaccinated, and we've seen very, very large numbers of people actually like coming to like our centers and getting vaccinated. And that is a very positive point. And I hope people like continue to come and to get vaccinated.
Yes.
Currently, we are still giving the vaccines at our polyclinics. The vaccines are free to everyone. So if you just go to the Ministry of Health website and just book an appointment, and you can come to our clinics and get the flu vaccine. I just want to reiterate the importance of it.
Yes.
It is very important also for people who are over 65. So we tend to really focus on those people who are above 65. People who have chronic diseases, so the diseases that stays with them for a very long time.
Yes.
So we are talking about heart disease, we are talking about the kidney disease, or even liver disease. Those people definitely need to get vaccinated, because they are the ones who tend to get more severe symptoms of the flu, and they tend to get hospitalized more often than the healthy individual.
So it could really start as a flu, as you said, and then it could get really serious. So I think it's really important that our viewers do take your advice and actually go use the service that we have here in Kuwait and actually get vaccinated this year.
Definitely. Exactly.
So you mentioned age. Are all ages getting the same vaccine, or does it differ from one age group to another?
Yeah, that's a very good question, actually. So the flu vaccine is given to all ages except for the children who are 6 months and younger. So we do not give the vaccine for like any children who are like younger than 6 months.
Yes.
But in general, it is for everyone. And like when it comes to the children who are younger than 6 months, that's why we encourage pregnant women to actually get the vaccination.
Okay.
Because it was found through studies that when babies are born, they might have some of the antibodies that the mother had against the flu. So like their risk of getting the flu is lower, because like young babies, they don't have an immune system at that point.
That's right.
Yes. So like in general, it is for all ages, but not younger than 6 months.
Okay, that's really interesting. It's something I've heard for the first time. So do the vaccinations, we can say, help with lowering the chance of getting affected by the symptoms of COVID-19? We do know they don't really target COVID-19, but does it help with the symptoms?
Yeah. Like when it comes to the flu vaccine, it does not actually like help prevent getting COVID.
Yes.
Because COVID is caused by a different strain of viruses. Some people, if you get the flu vaccine, you are protected against the influenza viruses, whereas when you get the COVID virus, it is a totally different virus. So it doesn't really like help from getting the COVID-19, but what it But what it helps with actually is it helps you if you get the COVID virus, that you do not get the flu on top of it. So you do not have to deal with two viruses at the same time, and that can be very, very dangerous on the body. So when you get vaccinated against the flu, you prevent yourself from getting two viruses at the same time. The tricky thing about COVID is that the symptoms, it's very similar to the flu. So so we see a lot of cases in like our clinic that present with symptoms, for example, the sore throat, or like they come with the headache, cough, sometimes like with the shortness of breath at certain times. So these symptoms sometimes can mimic what COVID might present with, and that can put more pressure on the health system here in Kuwait, because we cannot know what you're presenting with. Is it the flu? Is it the flu or is it COVID? So I guess that might be another like benefit of getting the flu, is to reduce the number of cases that the health system might see per day, where we might get mixed between is this flu or is this COVID?
Exactly, because it could be really hard for any individual or even doctors to know the difference unless there's really a test happening.
Exactly, especially when it comes to the early stages of it. Exactly.
Of course, because some COVID patients are even asymptomatic, so you won't even know they had it. So I can imagine how hard it is at the clinic for you guys every day.
Definitely, exactly.
So what are the side effects of the winter vaccinations? We do know that side effects are always something that come with medication, we can say.
Yeah. I think when it comes to the side effects, I think everything in life like kind of has a side effect. If you drink water too much, you are harming your body. I guess that's a side effect. So the flu itself, the most common side effects that we see like in the clinic is that when people receive their flu vaccine, they might have like some pain at the site of the injection. Some people might develop a very low-grade fever. So that low-grade fever would last for a day or two, and they might experience some aching in the muscle. But these symptoms only last for a day or two, and not all people actually get them. But these are the most common ones, and we do not see them like a lot in the clinics, and when we give patients these vaccinations.
Okay, so it's something that a patient should know they might encounter if they did take the vaccination, basically.
Definitely. If they experience any pain at the site of the injection, or maybe they cannot move their arms like as well as before, this is just a normal reaction of the body as it tries to develop the antibodies, and these usually would last for a day or two, and they'll be gone by then, and the person will be protected from the flu.
Perfect. Thank you for all the information. Right before we wrap up this interview, do you have any advice you would like to give our viewers today?
Yes. So first, I would like to thank you for the opportunity actually to speak about this.
Thank you.
And I guess my advice to people is to definitely get the flu vaccine. We want you to protect yourself, and we want you to protect your families as well. We live in a very close community where we have our parents, our grandparents who are aging as well. So please protect yourself and also protect them as well. And I wish all of you the best of health, and hopefully we can go through this period unharmed, inshallah.
Thank you so much, Dr. Ahmed. This information was really valuable to us. We had with us resident in Kuwaiti Board of Family Medicine, Dr. Ahmed Al-Bsairi, and now we're going to be viewing our next report on the World Health Organization. Stay tuned.